Hey everyone, welcome back to the Mass Retirees Weekly Update. Today's Friday, March 22nd. I'm Sean Duhamel. Thank you so much for joining with us and tuning in again this week. Now, happy spring, everybody. It has suddenly returned to be cold here in Boston again, but we've had a great winter. It's been very mild. Got a couple of more weeks until we're totally out of the woods, so let's keep our fingers crossed. But let me jump right into things this week. Now, we have been talking a lot about healthcare costs recently. As all of you know, the GIC, about a month ago now, announced pretty significant rate increases for the coming fiscal year. That'll be about 9.5% on average for the non-Medicare plans and an average of 4.5% on the Medicare plans. Nobody is happy about this. Nobody. Particularly our members. We know that all of you are living on fixed incomes. The last thing anybody wants to see is more money being taken out of your pension check to pay for health care or anything else. At the same time that we're concerned about what's happening with the GIC, the same situation that has developed at the local level. Across municipal governments, we are seeing about the same level of rate increases. So it doesn't matter if you're insured through the GIC or through your municipal government or a Blue Cross plan or a Unicare plan or a .32 Harvard Pilgrim Tufts, MGB, Fallon, neighborhood health plan. It really doesn't matter. The cost of healthcare benefits for everybody is going up. That being said, it is no surprise that the results of a brand new survey that just came out this week, that was commissioned by Blue Cross and Blue Shield of Massachusetts, confirms that healthcare costs are now amongst the major concern of Massachusetts residents. In fact, about 2/3 of those surveyed said that rising healthcare costs, that's health insurance premiums, co-payments, deductibles, the whole kit and caboodle, is of their top concern. And even more disturbing is the fact that 4 out of 10 respondents, so roughly 40% of those surveyed, said that they are choosing to either delay or defer needed health care because of the cost. Now let that sink in. 4 out of 10 people, and I know many of those folks are probably retirees living on fixed incomes, are choosing not to receive the medical care that they need because they simply cannot afford to do so. That's a huge problem. And unfortunately, we are now very concerned because of the trends we're seeing, not just here in Massachusetts, but all across the country, that the problem's going to get worse. We cannot afford, you cannot afford to pay, whether it's a 4.5% a year increase or nearly 10% a year increase in your premiums. At some point, we all hit the breaking point. You can't afford it. The government can't afford it. Private sector folks can't afford it. Private sector employers can't afford it. Something's got to give. And we give all the credit in the world, and we're thankful for Blue Cross and Blue Shield and their president and chief executive officer, Sarah Isling, for taking the initiative, getting out in front on this, and first of all, bringing public attention to the problem, and secondly, trying to rally forces around doing something about this, because it's not a problem of the insurance companies by themselves or the hospitals or the doctors. It is a collective problem that we all need to get our arms around. And if any of you watched the GIC's meeting and the email message that we sent out on March 1st, right after the GIC's February 29th meeting where they set the rates, that email blast contained the link to watch the GIC meeting. All of their meetings are streamed live on YouTube, and they're also archived on YouTube after the meeting occurs. So we use it as a resource all the time to go back and rewatch something. And there's a lot of information contained at these meetings, and sometimes you miss things. But if you go back and watch the meeting, you'll see that several GIC commissioners, whether they be labor representatives like Bobby Kaplan, the vice chair of the commission, right down the line, including executive director Matt Vino, everyone is concerned about rising costs. And as a matter of fact, the GIC commission has given instructions to Matt and his staff to explore different avenues to try to gain control over cost increases, and to do it in a way that's very mindful and respectful of the impact of any of these changes on enrollees. Because at the end of the day, we need to make sure that these benefits remain affordable, high quality, accessible, because if we don't have any of that in place, then the benefits are worthless. If you cannot afford to go to the doctor, what's the purpose of insurance? Or if you can't go to the hospital or the specialist that you need to see because you're sick and you need that level of care, again, that's something that we don't want to see happen. Now, we've been very fortunate. First of all, here in Massachusetts, we have outstanding health plans, whether it's Blue Cross or Unicare or Harvard Pilgrim or Tufts or the other companies I mentioned a moment ago. Any of those healthcare companies that we have here in Massachusetts, anywhere else in the country, they'd be the envy, or they are the envy of those areas. They're outstanding companies, so we're fortunate for that. At the same time, we have some of the best healthcare anywhere in the world here in Massachusetts, but it comes with a high cost. Now, fortunately, at the state level through the GIC and across most municipal governments, we have done a good job collectively working with labor, working with government officials, working with the insurers to hold the line on cost shifting, hold the line on bringing in high out-of-pocket costs and high deductible plans. In the private sector, those types of plans are becoming more and more common. It is not at all uncommon in the private sector to see the non-Medicare health plans have an annual deductible per person of $2,000 or more. And we've always believed that the deductible charged by the GIC of $500 is too high, particularly when you're looking at people on fixed incomes, never mind a $2,000 deductible. Our fear is that if we cannot collectively get our arms around this problem and find a way forward to gain control over costs, we're going to have more and more pressure placed upon us and placed upon government officials, particularly at the municipal level, to start cost shifting, to start eroding the benefits that all of you have earned and you fought hard for and that you're paying for, and now in retirement you depend heavily upon. We don't want to go down that road. So that's why Mass Retirees will continue to be a leader on these issues. You're going to hear a lot from us in the coming weeks and months and probably into the next few years about healthcare, about cost containment, about innovative ways of working with the providers to find solutions to these problems without taking anything away from you or making you pay more money for what you're already getting. Some of those innovative ideas are already up and running and they're only going to grow. The IBIS telehealth platform is one example of that, one small example of that, but is trending in the right direction. What we saw in the early 2000s, the last time medical inflation was spiraling out of control, was a series of efforts to either cost shift or quote unquote reform retiree health insurance. And typically what reform means is taking something away from you or making you pay more money for it. We don't want to go down that road. So again, we're thankful to Blue Cross for getting out in front on this. As a matter of fact, we have a labor advisory committee meeting next week at Blue Cross, and we'll be extending our thanks to the Blue Cross executive team at that meeting. We're very thankful that we have partners that we can work with, that our interests can align as best as possible with the interests of the healthcare provider community here in Massachusetts. We also understand the pressures and the strain that has been placed on our hospital system, particularly coming out of the COVID-19 pandemic. There's no escaping that, but it is not a blank check, or we don't have a blank check to give to anybody for continued rate increases into the double digits. It's just not sustainable going forward. And the last thing I just want to mention before we wrap this up, you can't talk about the hospital systems here in Massachusetts without talking about the crisis that's going on at Steward Health. There's virtually not a day that goes by where there's not some mention of the ongoing financial collapse of Steward and some of the allegations that exist of mismanagement and so forth. There are no easy solutions to what's happening there. I know that behind the scenes, the state's putting a lot of work into trying to find a solution. The hope is that that hospital network will be purchased by another provider to help right the ship and continue to perform or provide those extremely important hospital system services into the communities that they serve. So with that, and on that high note, we're going to wrap things up today. But the very last point is that we're going to continue to work on this. Nothing's going to change overnight, I can assure you of that. I hope that this message is not overly disturbing to people, but it is something we need to be mindful of. It is a problem that desperately needs a solution, and we're going to be part of that solution. We're going to make sure that you have a voice in the process and a seat at the table, and that we're continuing to work together moving forward. So with that, we're going to sign off for today. We'll be back next week, next Friday, March 29th. We do have a tele-town hall meeting that will focus on healthcare, specifically the GIC's Unicare plan, soon to be WellPoint, and the upcoming open enrollment period that begins, I believe, on Wednesday, April 3rd, and will extend through Wednesday, May 1st. So that meeting takes place next Friday at 2 p.m. I realize it is Good Friday. I apologize to those of you who are observing Good Friday and may have a conflict. Unfortunately, the 29th was the only day that we could schedule this meeting that would accommodate everybody, and it was important that we held this meeting prior to open enrollment starting. We will be joined in the meeting by Unicare's General Manager, David Morales, who will be taking your questions, your calls. So we're looking forward to a very interactive meeting. There are two ways that you can join the meeting. One, by just simply receiving the automated phone call that will come in from us at 2 p.m. as the meeting starts. All you need to do is answer the phone, stay on the line, and you'll be automatically connected to the meeting. The second way that you can join is by calling the toll-free number that's on the back of your membership card. However, when you utilize the toll-free number, that incurs a cost to the association. There is no cost if you pick up the phone for the automated call. So our preference, obviously, is to keep costs to a minimum and encourage our members, make sure we have your telephone number on hand, whether it's your cell phone or your landline, and we'll make sure a call goes into you. But if you don't receive a call and you want to join the meeting, look on the back of your membership card. It's the toll-free tele-town hall number that's printed there. But again, thank you so much, and we'll talk to you again very soon. Bye-bye, everybody.